Thanks, Kara. This is Cynthia Lambert, and I'm the Executive Director at the Kentucky Population Health Institute, and we certainly thank everybody for joining us today. I do want to remind everybody, if you could, I know you're also taking the poll. We want you to do that while we're letting people log in. I've got some people that are having trouble that I'm trying to help this morning. But if you could flip over to the chat, that would be on your guidance bar. It's either at the top or the bottom, depending on what kind of computer that you have. We do have the chat function open. I need you to type your name so we know who is here. Sometimes when you log into Zoom, it might have your phone number. Some of you have children that are doing virtual school, and so it has their name. And so it's hard for us to make sure that if you applied for CEUs that we are making sure that you actually attended. So type your name in, and if you applied for CEUs, if you want to put that behind there, that's very helpful for me because we have them organized that way. So if you applied for nursing, or if you applied for environmental or early childhood, all of that, that would be helpful. Thank you. I see everybody's listening. Thanks, people. So I have a brief introduction from the folks at Enviro Health Link that I'm going to play, and then I'll turn things over to Shelly. So hang on just a second. Let me share my screen.
Hello, and welcome to the Kentucky Children's Environmental Health webinar series. The purpose of this series is to help participants increase their knowledge of environmental exposures and how to reduce these for children. We would also like to introduce you to our Environmental Public Health Tracking Data Portal, which you can access by going to envirohealthlink.org. This easy-to-use website can be used to find Kentucky-specific health and environmental data. We want to say thank you to our sponsors for their support: the Kentucky Department for Public Health, the Environmental Public Health Tracking Program, the Kentucky Environmental Education Council, the Kentucky Asthma Management Program, the Kentucky Population Health Institute, and the University of Kentucky's Center for Appalachian Research and Environmental Sciences. And finally, we would like to say thank you to our planning committee, whose valuable input and expertise has made this series possible. We hope you enjoy our webinar series.
Okay, great, thanks. And those of you who are just joining, if you missed my request for you to type your name in the chat, along with if you applied for CEUs, let me know which kind so that I can send that to AHEC so that you get your CEUs. So I'm going to turn things over to Shelly Canada, who's going to introduce our speakers for today. Shelly?
Hi, I'm Shelly Canada. I'm with the Environmental Public Health Tracking Network program. Welcome to our webinar today. The topic for today's webinar is health systems using a health equity lens and creating equitable solutions for our children. It really gives me great pleasure in introducing our speakers today, Vivian Lasley-Bibbs and Teresa Davis. Vivian is the director for the Kentucky Department for Public Health's Office of Health Equity. She has over 25 years of public health experience. The mission of the Office of Health Equity is to increase awareness of health disparities, enhance patient-provider communication, improve cultural and linguistic competency in delivering health services, and improve coordination and utilization of research and outcome evaluations, and to also strengthen the leadership to address health inequities. Lastly, the Office of Health Equity works on addressing system-level barriers and challenges that drive outcomes that impact health and health outcomes for our minority and marginalized and vulnerable populations, with the ultimate goal of eliminating health disparities in Kentucky. Teresa, our other speaker, is a health policy specialist in the Kentucky Department for Public Health's Office of Health Equity. Her work involves specialized knowledge of state government, public health, local health, cultural competence, diversity, health equity, and minority health concerns and issues. Before joining the Office of Health Equity, she has served as the Commissioner of Housing Authority of Champaign County, Champaign, Illinois. a compliance officer for the Lexington-Fayette County Health Department in Lexington, a facility privacy officer and medical records director, quality improvement coordinator for Taylorville Correctional Center in Taylorville, Illinois. She's a co-founder, secretary for the Canaan Credit Union in Urbana, Illinois. Teresa is excited about contributing to the Department for Public Health's mission to prevent, promote, and protect and assist in ensuring that all citizens of Kentucky reach their fullest potential. And at this time, I'm going to turn it over to Ms. Teresa Davis.
Good morning, everyone. Of course, my name is Teresa Davis with the Office of Health Equity. And the goals of our office are to create awareness and educate others regarding health disparities, research and evaluation, cultural competency, health literacy, strengthen leadership, health and health system experiences. Our workshop objectives today are to introduce the concepts of health equity and the social determinants of health. You'll see that listed as SDOH later on, to illustrate ways that they can intersect with environmental health. And 3, demonstrate how to respond to health equity issues. And next screen, please. We're going to talk about definitions. Health equity is, according to a health equity scholar, Paula Braverman and the Robert Wood Johnson Foundation, it means that everyone has a fair and just opportunity to be as healthy as possible. And this requires removing obstacles to health, such as poverty, discrimination and their consequences, including powerlessness and lack of access to good jobs with fair pay, quality education and housing, safe environment and health care. That measure must show the reduction and ultimate elimination of disparities in health and its determinants that adversely affect excluded or marginalized groups. And when we define health equity, we also have a way to measure it. Without measurement, there is no accountability. And the Healthy People 2020 definition of health equity is the attainment of the highest level of health for all people. In working to achieve health equity, it requires valuing everyone equally with focused and ongoing social efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Next screen, please. So why, let's see, can we go back to how do we define health disparities, please? Okay, thank you. It's a type of difference in health that is closely linked to social or economic disadvantage. Health disparities negatively affect groups of people who have systematically experienced greater social or economic obstacles to health. These obstacles stem from characteristics historically linked to discrimination or exclusion, such as race or ethnicity, religion, social economic status, gender, mental health, sexual orientation, geographic location, or cognitive, sensory, or physical ability. And next screen, please. So why do we talk about health equity? As public health professionals, environmental health has a role in supporting health equity. And as environmental health practitioners, you witness many social factors that do indeed influence health equity. And how environmental health practitioners respond or interact with operators and clients can exacerbate or mediate existing health inequities. It's important that it is important that environmental health be aware of health equity issues and the social determinants of health that can lead to these inequities. And now we have a video clip that we'd like to play for you.
It's just, there's all this pressure, you know? And sometimes it feels like it's right up on me and I can just feel it, like literally feel it in my head, and it's relentless. And I don't know if it's gonna stop. I mean, that's the thing that scares me the most, is that I don't know if it's ever gonna stop.
Yeah. Well, you do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it.
No, I'm not trying to fix it. I'm just pointing out that maybe the nail is causing...
You always do this. You always try to fix things when what I really need is for you to just listen.
No, see, I don't think that is what you need. I think what you need is to get the nail
See, you're
out.
not even listening now.
Okay, fine. I will listen. Fine.
It's just, sometimes it's like, there's this achy, I don't know what it is. And I'm not sleeping very well at all. And all my sweaters are snagged. I mean, all of them.
Yeah, that sounds really hard.
It is. Thank you. Ow!
Oh, come on. If you would just...
Don't.
Try to see things my way. Do I have to keep on talking till I can't go on? We can work it out. We can work it out.
And now I turn it over to Vivian Lasley-Bibbs.
Hello, everyone. Hopefully you can hear me. So I really love that video that you just saw, that little clip, because I think it does two things. I think it reminds us of how sometimes we think of things as, well, it's what we see, it's the obvious. We're going to address what we see and what we know to be what we think the imminent issue. And sometimes if we just step back and take a moment to listen to our stakeholders, our clientele, our end users, sometimes we find out something totally different. So I think that kind of gives us a kind of a funny way to say, yeah, we need to listen more. And also it kind of gives us an opportunity to kind of gauge this conversation around health equity, which sometimes people have a hard time, that concept kind of is abstract to folks and kind of leaves them with, what is really health equity? And health equity by definition you just heard, but health equity is to really think about those things that affect populations either unfairly or unjustly, that put them at a disadvantage, that is shown through a disparity, through a rate and a number. That's what's really impacting populations. And sometimes they are not to be put into boxes, but they really do intersect. And I hope we get that from this presentation, that you see that today. So I like this Robert Wood Johnson description of equality versus equity. And there is a difference. And I go around when I lecture and I talk to folks, I'm very surprised that people think they're one and the same, but they're very different. So in the top representation, you see what we have done to show equality. That means everybody gets the same bicycle. But at the same vein, you notice that that didn't meet the needs of all of those individuals in the top photo. To make things more equitable, we really have to look at the unmet need of that person. For example, the young lady that's in the wheelchair, her bicycle was accommodated to meet her need. So now she gets to enjoy bicycling just like everyone else. And for the young person at the far right of the screen, that bicycle was going to be very difficult to ride. And now one has been fit just to meet that need. So now everybody can enjoy riding. Let's think of it another way. And there is a fourth frame to this picture showing where the fence is removed altogether, and they call that liberation. But for my purposes today, I'm going to use this slide to kind of depict again equality versus equity. So we'll have in our mind what that means. And some of you all may have already seen this slide. You know, when we think of equal, we give everybody the same thing. So the boxes are the same height. But we see that there's still someone that's not able to enjoy watching the game. So to make it equitable, we distribute those boxes according to need. So now everybody can see the baseball game. But what's the reality? What's the day-to-day that we work in? We see that some are naturally have more resources than others, and some don't have any at all. So it's not just merely putting additional boxes, but to understand the environment and the social context in which that community, that population, that individual lives. So let's talk about social determinants of health for just a moment. They're interrelated social and economic factors that shape social policy and influence health. But they're not, these are some listed, but they're not limited to these. So we think of socioeconomic status, education, employment, healthcare access, transportation, food security, that can be either food deserts or food insecurity, food swamps, working conditions, mass incarceration, healthcare access, the physical environment, and housing, which we'll get into more with this conversation today. But these don't act in isolation. Many of these are happening at the same time in our communities that which we serve. So let's talk about some examples of physical determinants. That meaning green space, the natural environment, trees, grass, the weather, climate change, and then that's that built environment, bike lanes, roads, sidewalks, our recreational facilities, our schools, the housing and community design. And I think we're thinking about that more and more as we've moved through COVID-19 to see just how important community design and housing is for populations that you're trying to reach during a pandemic. Exposure to toxic substances and other physical hazards, physical barriers for especially folks that have disabilities of any kind, and then aesthetic elements. All of us take advantage of good lighting, trees, and benches in our community. So how does all of this and all of these social determinants impact our physical and mental health? Well, I've just included this example because I think it gives us a good indication of how all of these working together to have great stress on our physical and mental health. Stress from all sides. Transportation, if you have the lack of, that's a stress. Inadequate housing, substandard housing, that's a stress. If you live in a segregated neighborhood, that's a stress. Poor air quality, stress. Increased commute time, stress. Lack of access to stores, jobs, and services, stress. Poor quality education, stress. Crime, stress. So we all know that the endocrine system, that hormone cortisol, when it's released, and it's released continuously over time, that buildup has long-term health impacts. And then on our mental health as well, we don't recognize the impact that all of these things are taking a toll on our mental health. So let's talk about how all of those interplay and interact with some of our environmental health issues. So let's talk about some of those other things that weren't listed on that paper that may be a little less tangible, some things that you don't see day to day, which are systems of power that operate, those that have it versus those that don't. Structures that have been put in place, who, what, when, and where things happen, and what takes place when. Policies that are written, practices and norms sometimes that are unwritten, those unwritten rules, right? Those social norms that go on within communities that somehow have been passed from generation to generation, not written, but we know them. And then values, why we have certain values. So what do we know thus far? So we know through research that in the US, people of color, lower income, and tribal populations are disproportionately exposed to those environmental hazards that can affect their health and many times make existing health conditions worse. We do know that zip code determines your health more than your genetic code. We know that there's environmental racism. And just so we're all on the same page with that term, environmental racism is any policy, practice, or directive that differentially, whether intended or unintended, affects or disadvantages an individual, group, or community based on race or color. That places millions of Americans and their health at a special risk. And then we have redlining. Many of y'all may be aware of that, and we have that demonstrated in our state. Louisville has had many publications on the redlining that was done there, and that was used by the banking and loan industry and the Fair Housing Act to ensure that loans were not given out into those zones that had been determined to be red because they were not favorable, they were low income, and they were communities of color. And that is still subconsciously used today, whether unconsciously used today in many of our cities and our states. So I want us to be aware of redlining and what it is and how that redlining has been used as a tool to suppress some communities and to make sure that those communities are intended to stay where they are and to not have the resources that other communities have. And then you have systems and institutional barriers that also come into play. And within those systems and within those institutions, you have policies and practices that impact communities. So let's talk about what we call the health gradient. So we have people that face many barriers, many of their health hazards, many unhealthy environments, in addition to chronic health conditions. So when people feel that all of this is compounded on them, it's like moving a rock uphill. They lack positive social determinants, so they always feel like they're facing an uphill battle just to stay healthy, just to maintain. As public health practitioners, it's our role to help them flatten that curve or to make it easier for them to push that they carry day to day uphill. So place really does matter. If you haven't watched Unnatural Causes, it's an older video now, but to me, it really does demonstrate that where you live truly impacts your health and what that environment looks like, the built-in physical environment in which people live, how it takes a toll on your health. So one of the areas focused on was in Louisville, Kentucky, when Dr. Ottawale Troutman was there, really looking at how zip code impacts your health and how you can be in one zip code and 4 miles to the east or west puts you in another zip code, and your life expectancy can either increase or decrease by almost double digit in years. So place really does matter when we talk about impact on people's health. So let's talk about the impact on children's health. So let's talk about that environment that we find, whether it's due for climate, whether it's due for housing, whether it's due to pollutants in the air. We know that children in Kentucky, especially children of color in elementary age, their asthma levels are greater than their white counterparts. And it really does impact student participation in school. Absenteeism goes up. Students aren't able to perform. Then we have mold, bed bugs, and other infestations in subpar housing. We don't have a safe space for our children, and that creates stress. Food insecurities creates additional stress and impacts our children's health. Research is being done on noise, and in communities where there's constant noise, whether that's through environmental things that are producing that noise with industry, whether it's violence in the community, whether it's the actual in the home noise created between domestic issues with those in the household, the adults in the household, and how that impacts performance in schools. Trauma, and whether that's trauma outside, external, in the neighborhood, or whether it's trauma in the home. other stressors, and just poor housing in general, how all of that impacts children's health. And I think sometimes we think of those as acting in isolation, but they don't. Just think of how that can become more complex when all of those things are compounded. So when we talk about the inequities in the social determinants of health, we talk about how we've just talked about they could be associated with undue exposure to unhealthy environment, how an individual's actions and ways affect their exposure and health status. Sometimes when we have environmental exposure, it's not that we are intentionally putting ourselves at risk, but because of what we are surrounded by, we don't live in isolation. So naturally, we're going to make ourselves, we're going to avail ourselves to those things just because we have no choice. So it would be hard to tell children not to play near something if that's the only area that they have. So it's not that they want to be exposed, it's just they have sometimes no choice. So sometimes we can increase vulnerability to environmental factors that negatively impact the health and well-being. So, and it may be associated with decreased access to services that could address the impacts of unhealthy environmental exposures. Many times within communities of color, there's not access to quality health care. So that's impacted by unhealthy environmental conditions. Not be able to access treatment, access resources and educational information that would let you know that there is a hazard or there is a health implication to what's going on in your environment. So let's talk about for a minute, if we identify health as our destination, and everybody wants to be healthy, I think we can all agree on that, then social determinants of health is the roadmap to get us to that destination. And what do I mean by that? In order for us to really to think about optimal health and wellness, we have to think about all those social determinants that we've talked about thus far. We have to think about the places where we live, where we learn, where we work, where we play, and even where we pray. We have to think about all of those social determinants to impact optimal health, that impact optimal health. And we can't think of them and put them in nice separate little boxes. There's a lot of intersectionality to all of those things, which really makes it complex. And sometimes it's not the issue that we think or that we see that's present at that moment that is the ultimate need to obtain that optimal health that communities or individuals need or that they want. But sometimes we have to kind of go back to that video and just kind of listen, kind of forget the obvious of what we see, the lens that we're looking through, and listen to what the person is telling us that's actually going on with them and the needs that they have at that time, at that moment. So let's talk about that intersectionality for just a moment. And I use this depiction of a four-way stop to kind of think of that. So let's think about what's going on in this intersection. So we have socioeconomic status, we've got job insecurity sometimes, we have folks that have to go to work because they're sick, because they don't want to lose that job, because that's the only person in the household that may be providing financial resources to make that a stable home. Let's think of cultural differences. And sometimes we have expectations as environmental public health practitioners that we don't recognize those cultural differences and how things can be translated differently, and how sometimes what we're asking people to do as it relates to some prevention of an environmental exposure or a hazard, they don't recognize what that means because of a language barrier or because of some cultural or social norm within that community. That's what they've used, or that's what they have grown accustomed to. So there's an education there that needs to take place, and we need to recognize that. The language and literacy barrier, of course, low literacy or computer literacy, when we ask people to be cognizant of regulations and requirements. Let's think of the stress, and we've all kind of been dealing with stress here lately, so we know what that can do. It can cause distractions, it can intensify other barriers, and housing issues such as bed bugs or mold can compound stress in addition to having that environmental issue. And let's think of geography. Do they have access to things that you've told them they need to fix or to adhere to or to be cognizant of? Do they have access to equipment, parts, or expertise that's required of them? The food security in remote communities, and you're telling them not to do certain things with their meats or foods, but in their culture and in their remote community, that's all they have access to. So alternatives might not be an issue. So we need to recognize some of these categories and how these all intersect and how they all interact and how we have to consider these when we're talking about environmental health with marginalized and vulnerable communities in our state. But here's the to me, statement that's most important. Inequities related to environments are modifiable, meaning we can do something. We can have people understand, come to the realization that their environment is not fixed. It can change. And that's our role as public health practitioners and environmental health specialists to help them recognize that. So how do we get started to do that? How do we start addressing equity? So this is both an internal reflection, and then we need to take it externally and ask ourselves, in our line of work as environmental public health specialists, as public health practitioners, do we see structural or institutional barriers or policies or norms and values that are operating here that are impacting communities? What of any of those environmental conditions, exposures, et cetera, are perpetuating a specific condition? If it's asthma, if it's perpetuating the asthma or the housing situation or the mold or the mildew or whatever housing implication has been recognized, how is it being perpetuated? And what can we do to rectify that situation? What's present, what's lacking, and how do we partner around the issues and conditions that affect people's lives? Of using the health equity lens. So I think it's important for us to kind of think about who might already be working on this issue. Who can we reach out to? Who can we partner with? Who can we collaborate with? Who within our own agency or outside our agency can we use as a resource? Who needs a voice or who needs an advocate in this situation? How does what I recommend fit in with the community priorities? And I think this is a very important one. Just because we feel like we have a solution, that may not be the solution that the community wants or sees that they need at that specific point in time. And based on what we find out above, what revisions could be needed as far as policy, as far as practice, as part of a decision under discussion. So maybe that's an opportunity to bring in those that deal with housing issues, the landlord. Maybe there's some kind of policy or implication there that needs to be brought to the attention of those in the governing bodies that may regulate that housing entity. So we need to be aware of those type of things. So using an equity lens, are all groups affected by this decision, by policy or practice? Racial ethnic groups or residents, low-income individuals, people with mobility limitations, they may be the folks that are being impacted by this issue, and are they at the table? Are they able to vocalize what is affecting them and impacting their health? What disparities do they currently experience? Because we need to recognize that there's a disparity there. What's compounding or exacerbating that current condition? How will policy, practice, or decision affect them? And how will it be perceived by the group? Does this policy or practice worsen the disparity? Is there a community group that it impacts greater? Because sometimes recommendations and policies that are made, we all think they're a good thing, and we think we're impacting everyone in that population, but many times one population is benefiting over the other. And we need to recognize that if that's becoming harmful or non-beneficial to one group, then that's something that we need to look at. And that may not be the avenue that we choose to do, that avenue or road we choose to go down. Are all groups who are affected by this policy or practice, Are they at the table? We've said that. What's the history of the issue in the community? If it's been a long-standing issue, if addressing some environmental issue has been long-standing in the community, ask the why is that? What is the why behind that? And knowing that why, do they think it's an important issue? And if it's not a priority, sometimes people need to understand why it should be important. So like I said, we've got to ask those internal and external questions. And then we need to, as public health, environmental public health practitioners, what do we do in response to this? So we need to ask folks what additional barriers, other than that one that's ever present, that environmental issue that's present, what other barriers do they face? So we've got to identify ways to help people work around these barriers, consider how the public health system could better serve them in certain situations to remove that barrier, raise awareness about where barriers persist and how they impact public health, discuss with management and contribute to conversations about what you're seeing and how to make policies and programs more equitable. You can be that voice. What you see can be brought back to those that make decisions that impact communities. And you can actually inform and educate those that may not be in the field seeing what you're seeing and seeing the day-to-day that you're seeing at the local level, and be made aware of changes in either policy or practice or regulations or things that you do or expect to influence on a day-to-day, that how that can be made more equitable. And we can also identify other partners who may need to respond to address some of these inequities. And that's why knowing what's available in your community, knowing what resources are available, knowing what agencies do what. And sometimes I understand we get kind of bogged down in our own little world and our own little silos. And sometimes we don't recognize how we could partner or collaborate with other people who are doing similar work. And if we just kind of communicated where we are and what we're doing, that's beneficial for everyone. So I love this quote where it says, it's important to repeat again and again what drives inequities with staff, with elected officials, with the public, to help change the narrative. So if we're ever to address health inequities, we've got to understand what those drivers are. And we talked about social determinants of health, but we also need to talk about some of those, I call social determinants of health those midstream factors, but we also need to talk about what we call upstream factors, which are what we call root causes in my world of health equity. And those root causes are those systems of power, those structural and institutional. All of those isms are packaged as root causes. And until we address those systems and talk about those root causes, we're going to have a hard time just thinking about social determinants. Because if we address social determinants, there's some other conversations upstream that need to happen, because we're never going to close that disparity gap as long as we don't address the root causes, right? So there's a tool that I really like within the Environmental Public Health Tracking Network. It's called the Social Vulnerability Index. And it's really a valuable tool because it really looks at county level census tract data, meaning we can look at demographics. We can zero down to, let's take Fayette County, for example. I can not only look at zip codes within Fayette County, but I can look at census tracts within Fayette County. I can go down to the census tract level. I can look at SES. I can look at race, ethnicity. I can look at schools. I can look at transportation. I can look at all of those social determinants of health and see where, just how much of that and whether that community has a transportation route related to it. I can look at where the resources need to be really placed and not just covered within a specific zip code and making it equal, but I can really get at an equity issue using that tool, determining this is a census tract that really has some of these drivers, some of these social indicators that are really going to impact health. I can also overlay that with chronic disease data to show where people are at greatest risk. I can look and see where those persons have through 500 counties or 300 Health 360 data sets that I can overlay with that are telling me that within this census tract, X number of people have hypertension, diabetes, chronic heart disease, and that's valuable information if we're going into a community for an environmental issue. And we also see that this is a community that's impacted with poverty, disease, and lack of resources. That's powerful information as we go about doing our work to improve the health of this community. And I would love for you to go to the Environmental Public Health Tracking Network website and look in their data portal, and you can see the Social Vulnerability Index. Pull up your county, play around with it. There's also community profiles that are there. Play around with the Social Vulnerability Index. We're offering trainings in the future on how to use that tool. We're trying to incorporate now other data resources that we can pull in to overlay on these maps so we can really get a visual, a really good indication of where we need to place our time, our energy, our resources to improve the health of these communities. So what are some of the action steps that we need to take? So what can we do? And as public health professionals, as environmental health professionals, what can we do? So I think as health protection directors or managers or whatever your title is, I think we need to consider possibilities that explicitly integrate equity into your organization or into your structure, your program. And how do you go about doing that? Well, first you have to understand what it is, and you have to get everybody on the same page to recognize the importance of health equity and how those inequities are impacting the health of that community. And you can only do that by creating dialogue, networking with folks to facilitate collaboration within health protection departments, within other sectors inside and outside our public health system. Sometimes people right down the road from us are working on similar issues and are trying to address some of these similar issues. And if we just kind of shared that information and had a way to communicate that, we could all kind of pool our resources and address an issue that's plaguing this community in a multiplied, amplified way. So then we need to designate health equity champions or teams. And that's what I want to empower. I hope I empower you a little more today to be a health equity champion, to recognize what some of those social determinants are, what some of those inequities are within communities, what some of those drivers are, some of those social indicators that we've talked about, how they impact health. Peer mentoring among public health professionals. And that's what I do. I try to do with my colleagues at the State Department for Public Health. Is take an opportunity to educate them, make them aware of those social drivers, to help them see how they can incorporate addressing health equity within their programs and how to implement them in their strategic plans and policies, and how they can take the opportunity to have cross-sector collaboration within the Department for Public Health and externally with other agencies. So I just want to leave you today with some resources that I think are really valuable. There are health equity and environmental health toolkits out there that will walk you through a more in-depth look at how health equity issues impact environmental health. There are exercises, there are tools that can be used, there's case scenarios, there are videos, there's PSAs, there's a wealth of resources available to you that you can take a look at when you really want to start taking a deeper dive and address health equity through an environmental public health lens. So I think we all need to be aware of the different lenses and not always look through our professional middle class lens, but to really start looking through a health equity lens, which is really taking in the social context, the political environment, the physical built environment of the communities in which we do our work. And only when we look through that lens can we be truly effective. So I'll leave you with that. I'm sure there's going to be an opportunity for questions. And I thank you for the opportunity to share just a little bit with you about health equity and its impact on environmental health. I guess if you've been putting questions in the chat, there'll come a time when we'll take those and answer those. But in case you get in touch with me to do any additional trainings on health equity, to help you use the Social Vulnerability Index tool, please reach out to us. I know that that may be difficult now, but we still can do some virtual things. And then hopefully in the future, we can make that a face-to-face with you all to do some really intense training on data tools, on health equity, and how you incorporate those in doing environmental public health work. So again, I thank you.
All right, Vivian, I did see a question in the chat related to the training that you're going to do. And they wanted to know, is there a schedule or how can they find out more information about the training?
Is this for the Social Vulnerability Index training?
Yes.
Or health equity? Okay. So Brittany Bell has taken over leadership within Environmental Public Health Tracking Network, and I'm working with Shelly and Brittany and their staff on putting that calendar together. We want to make sure that there's some additional things that the Environmental Public Health Tracking Network staff are working on. They're bringing in several other indicators to strengthen that tool. So we're going to be putting together a calendar hopefully in the fall, if we're able to move about in the fall, and to try to bring health departments on at that time. So we're just trying to make sure that we can do it safely, and it's best to do that training face-to-face. So that's what we're hoping for. And we also have something called the COVID-19 Social Vulnerability Index, which is also a useful tool. So we're working with those in tandem to do training. We'll probably do the Social Vulnerability Index tool first, and then do the COVID-19 Social Vulnerability Index training second. So we'll do them in phases. So as soon as I get a calendar and work with the Environmental Public Health Tracking staff, network staff, I will be happy to let you know the schedule, and I'm sure Shelly and Brittany will be putting that out there on their webpage, or be able to have a way for you to contact us to start those trainings. Did I speak out of turn, Brittany and Shelly? I think that's...
We'll be helping you market that and getting the word out.
Okay.
All right.
It's a very useful tool.
It is. If you have any questions, please type them in the chat box.
Y'all got to have at least one question for me. I know. Come on.
Maybe you just did such a good job presenting all the information.
Even a comment about my even a comment about my background. I mean, hey.
All right.
This is good for you, Shelly. The results from the...
Oh,
yes, there was a participant who asked about the unnatural causes video and wanted to know how to obtain that.
Yes.
So Vivian, this is Cynthia. I posted the link to the Unnatural Causes website, but you have to buy the CDC from them. I do think there are some ways to watch that through PBS, or that people have put it up on YouTube.
I was going to say that, Cynthia. You can watch it through
I'm not
PBS.
sure about that. I thought you might know.
Let me, I actually have a copy of the CD. I'm hesitant to send that through the mail. Let me research that. And if you could leave your email, whoever asked that question, I will see how you can get that through public access. You may not get all of the video, but the place matters piece has been used so much. It's probably out there and someone has probably captured that. So let me research that and I'll send you the information. How's that?
That's great. Also, it looks like Sue Thomas Cox is saying that they have DVDs of unnatural causes that can be loaned, and that there's a contact there with Tracy Sparks.
Okay, very
so those
good.
of you, so those of you in Kentucky We do have people that are not from Kentucky on our webinar this morning, but those of you who are in Kentucky can make that request through DPH.
Okay.
Thank you, Sue Thomas Cox.
I also see a question about when you're bringing together partners, can you give examples of some of the partners that are most valuable to make the decisions?
Sure. In communities that I have actually seen this really beat it and really address an issue, housing was at the table, city planners were at the table, residents that were going to be a part of this community development were at the table. And I'll give you an example. Is when Lexington did, it used to be Bluegrass Aspendale, and it was in the East End. And there were certain things they wanted to do to that community that the community actually, residents that were in the old, what we called housing projects at the time, residents were going to be placed in the new structures. There were some things that they thought they should have just like every other community. But in the original plan that was coming out, they weren't there. So housing, planning and development, Lexington Fayette Urban County government, and those new residents came together to talk about, no, we need green space area that just like other parts of the city have, because that's important for us. Green space, a safe place for our kids to play, sidewalks, all of those things are important environmental health issues for us, because they recognized that they were a community that had some disparities. The numbers showed within those zip codes, there was food deserts, there was not access to certain things that other communities had. They recognized that they had hypertension, obesity, and chronic heart disease as African Americans within that county, that they were at greatest risk, right, for other things. So if you wanted them to move more, to be active, to eat better, move more, there were certain things that were required. So that was the community recognizing an environmental need, right? Green space, sidewalks, safe place for the kids to play. That's just one example of where people can come together to discuss an environmental issue that may impact a vulnerable population. Other issues, there could be other issues around not just housing, there could be other issues around another example, and this is an old example, but the Rubbertown issue in Jefferson County, industry being built near a neighborhood. Another example is bus routes being backed up to low-income neighborhoods. Well, what comes with bus routes? Comes exhaust, comes exposure to pollutants and low air quality, right, that other communities may not be exposed to. So there should be, why would you put a bus what's the word I'm looking for? Where the bus transit, where you make changes, where buses are housed, backed right up against a low-income neighborhood. So there are things like that that I think we as public health practitioners need to make communities aware that they have that voice, that you can say, no, this might not be a good thing, because look at what already impacts our community. And this is just going to be another compounded issue that makes our community more vulnerable. So I hope you can see how those kind of interconnect, and I've done a good job of showing you how all of those pieces fit together, and how either of those not being expressed or not being brought to the attention of those that make decisions can really impact the health of communities. And I think it's our responsibility as public health practitioners, whether we work in environmental health, whether we work in chronic disease, whether we work in other areas of public health, that we make that, we help bring that to the attention of our clientele, of our constituents. I think that's our responsibility. or at least I feel it's my responsibility, I will not speak for you, that I need to make that population or that community or that individual that I happen to be providing a service or to make them aware of how all those pieces connect and how all of those create optimal health and wellness for them, both physically and mentally. So, and I think the stress piece is important. And I think we need to let people know how those stressors, right, and how all of those compounded stressors impact long-term health.
You've also
Is there
done
any other questions?
You've also done a lot of work with the faith-based communities in addressing
Yes.
things, chronic diseases. Would you like to talk a little bit about some of the work you've done?
Sure. I think the faith-based community and communities of color, we all recognize that's a valued and trusted resource. And then not just African-American communities, there are other cultures that recognize their faith leaders as trusted entities for their information, and they look to them to provide resources to give them credible, factual information. And we've gone to our faith leaders multiple times for different things to kind of help us address a chronic health issue, whether it be hypertension in African Americans, whether it be cardiovascular disease and stroke within communities of color, whether it's been in diabetes in both our Latinx and African American communities. We recognize that that's a valuable connector for these communities. And that is I won't say it's the only, and I don't want for people to walk away thinking that's the only way to get information, credible information out to communities of color, because I do think we have a tendency to go to our faith-based leaders with everything, and not everyone uses that as access to their information. And I think that's so important that now we're recognizing the value of community health workers, recognizing the value of health champions within communities. Ms. Johnson may be where a lot of people get their information, but Ms. Johnson may not really go to a traditional brick and mortar church. So, you know, we have to recognize that there are other ways that folks get their information, and there are other folks within communities to get their information and resources. So, you know, yes, faith-based community is a great resource, but there are also other folks too that we need to start tapping into to make sure that we get our messages out about how important public health is, how important sharing health information is, how important the connection between environment and public health, the environment and your health. I think that's very important, and we need to think of multiple mechanisms and multiple ways to do that.
There was also, and I'm not sure that you can answer this, Vivian. It's about asthma. It said, with kids being at home for school this fall, is anyone tracking the uptick in the office ED visits due to asthma?
Is Sue Thomas Cox still on the
Yes.
call? Sue might be able, that's one of her program areas. She may be able to address that better than I can. I don't see her cutting her mic on. There she is.
I'm not sure I can answer that. I'm not sure because it's more difficult to do real-time tracking of diagnosis, if you know what I mean. We also know that in September, when school starts back and kids actually get together, typically there's always that third week, peak week of asthma. Now, this year, they won't be in there for the third week, peak week, but I bet you in October, we might see that peak, you know, once kids actually get back in school together. So that's as much as I would say about that right now.
Thank you, Sue. I don't see any more questions. If you think of questions later, you've got Vivian Teresa's contact information. I'm sure they'll be happy to answer them. You can also contact me at shelly.canada@ky.gov, and I will if I don't know the answer, I'll try to find someone that does. Thank you, Teresa. Thank you, Vivian, for this presentation. I learn something new every time I hear you speak. So thank you. Cynthia, do you have anything?
Thank you, you all.
Yes, thank you, Teresa. Thank you, Vivian. I do want to remind people, some people I don't think are looking at the chat. The link to the survey, we really value your feedback on this webinar, is there. You're also going to get an email from me. And if you think other people could benefit from this webinar, this will be available in a few weeks on Kentucky Train. We're making that available for continuing education as well for folks that weren't able to join us today. So please fill out the survey, SurveyMonkey. You'll get an email from me, plus it's over in the chat right now. And if you applied for CEUs, you have to do that survey. So anyway, it's been great. Thank you, Vivian. Always good to work with you, and hope everybody has a great rest of your week.